From United Nations Television, this is UN in Action.
A country of just over 700,000 people, Guyana is rapidly losing a valuable asset: its skilled nurses. Lured by offers as much as $55,000 a year, far exceeding what they could ever hope to earn back home, some 25 to 50% of Guyanese nurses are leaving.
Swallow. Economically, things became better for me when I came to America, United States of America. And that was the reason why I migrated.
But money wasn't the only reason Jacqueline Goldstone left home after receiving free training in Guyana.
I wanted to develop myself in terms of my education.
Jacqueline eyed the United States as a land of new opportunity. Settling in Brooklyn, New York, she worked hard to fulfill her dreams. During the day, Jacqueline worked as a nurse. By night, she hit the books. Today, she's a nurse practitioner at Brookdale Hospital Medical Center. American hospitals like this one are starved for nurses. Brookdale's Director of Nursing, Susan Pinacchio, says too few nurses are graduating from American schools.
The reason we can't train enough nurses here is because they don't have enough nursing instructors.
To handle its workload, Brookdale is forced to recruit from abroad. But what's helping the U.S. is hurting Guyana. The United Nations Population Fund, UNFPA, is assisting the government with funds to tackle healthcare issues. Harold Robinson, director for the Caribbean region, believes that the exodus of nurses is affecting progress.
All the efforts, not only all the country's efforts in terms of reducing maternal mortality, but all the health sector efforts are really constrained by this out-migration.
Over the last 50 years, Guyana has trained thousands of highly qualified nurses. But as fast as they can train new ones, other countries are scooping them up. Minister of Health, Dr. Leslie Ramsamy.
Let's not have any doubt and make no bones about it. Migration of our health workers impacts severely on achieving health for all.
To compensate for expected losses of nurses, Guyana has already increased class sizes. This year alone, some 700 students are enrolled. Close to half will leave. In exchange for free training, all Guyanese nurses sign a contract, agreeing to work between 5 and 8 years in the country. If they break their contract, they must reimburse the government.
I had almost completed my contract, probably like a couple of months short of that before I left, but I still had to pay some money.
But now, Jacqueline is anxious to repay some of her country's investment in her training. She visits Guyana 3 times a year to provide care to those in underserved communities. It's an ongoing battle for Guyana to guarantee decent health care for all. And with the constant flow of nurses leaving, that goal may be harder to achieve than ever. This report was prepared by Mary Ferreira for the United Nations.